Welcome to today's video about Sjögren's symptoms. Have you ever wondered why some diseases go unnoticed for years, quietly affecting millions without a single warning? Sjögren's syndrome is one of them. It's not just rare. It's misunderstood. Over 4 million people in the United States alone are living with this condition, and yet many don't even realize it. Globally, it affects nearly 1 in every 100 people, mostly women. But here's the shocking part. Its symptoms are so subtle that they often get brushed off as something else. Dry eyes, dry mouth. You might think it's just dehydration or a side effect of aging. But what if it's something more? What if those everyday discomforts are signs of something much bigger? What if catching these symptoms early could prevent years of discomfort and health risks? Today, we're diving deep into the 15 critical symptoms of Sjögren's syndrome that you should never ignore. And trust me, number 7 will absolutely surprise you. It's one that even doctors sometimes overlook. So stick around, because understanding these warning signs could change everything. Before we jump in, make sure to like this video and subscribe if you want more life-changing health insights. Now let's uncover the truth behind Sjögren's syndrome and what your body might be trying to tell you. Please note, this video is for informational purposes only and not a substitute for medical advice. All research is verified. References are linked in the description. Now let's uncover the key symptoms of Sjögren's syndrome, starting with the very first one you should never ignore. Dry eyes. Imagine waking up each morning with eyes that feel like sandpaper. For many living with Sjögren's syndrome, this is a daily reality. The culprit? An immune system that mistakenly targets the body's own moisture-producing glands, including the lacrimal glands responsible for tear production. In Sjögren's, the immune system's attack leads to inflammation and damage of the lacrimal glands, resulting in significantly reduced tear production. This isn't just about watery eyes. Tears are a complex mixture of water, oils, and proteins that protect and nourish the eye's surface. Without adequate tears, the eyes become dry, irritated, and more susceptible to damage. Recent research has shed light on the underlying mechanisms of this process. A study published in Scientific Reports in 2024 found that patients with Sjögren's-related dry eye had significantly lower levels of lactoferrin in their tears compared to those with non-Sjögren's dry eye and healthy individuals. Lactoferrin is a protein with antimicrobial and anti-inflammatory properties, and its deficiency may contribute to increased ocular surface inflammation and discomfort. Understanding these mechanisms is crucial for developing targeted therapies. By identifying specific biomarkers like lactoferrin, clinicians can better differentiate between types of dry eye and tailor treatments accordingly. This personalized approach offers hope for improved management of dry eye symptoms in Sjögren's syndrome. Next, number 2, dry mouth. Living with Sjögren's syndrome often means grappling with persistent oral dryness. This isn't merely a minor inconvenience, it profoundly affects daily life. Saliva plays a crucial role in maintaining oral health by neutralizing acids, aiding digestion, and protecting against microbial invasion. When its production diminishes, individuals may experience difficulties in speaking, eating, and an increased susceptibility to dental issues. A comprehensive study published in BMC Oral Health in 2023 surveyed 1,458 individuals diagnosed with primary Sjögren's syndrome. The findings were striking. Approximately 87% reported experiencing frequent or constant dry mouth. Notably, 74.9% had not reported their dry mouth symptoms to their dentist prior to their diagnosis, highlighting a significant gap in communication and awareness. These insights underscore the importance of recognizing dry mouth as a significant symptom of Sjögren's syndrome. Early detection and proactive management are essential to mitigate its impact on quality of life. Regular dental checkups and open communication with healthcare providers can lead to timely interventions, helping individuals maintain better oral health and overall well-being. Next, number 3, dental decay and gum inflammation. When you think about autoimmune diseases, oral health might not be the first concern that comes to mind. However, for individuals with Sjögren's syndrome, dental decay and gum inflammation are significant issues that can impact daily life. A recent study published in the Journal of Dental Research, 2024, utilized a genetic instrumental variable approach to investigate the relationship between Sjögren's disease and oral health. The findings revealed that Sjögren's disease has a detrimental effect on dental caries and promotes periodontitis. This suggests that the autoimmune mechanisms in Sjögren's not only affect salivary glands but also contribute to the deterioration of oral tissues. This research underscores the importance of proactive dental care for those with Sjögren's. Regular dental checkups, meticulous oral hygiene, and collaboration between healthcare providers are essential to manage and mitigate these oral health challenges. Next, number 4. Recurrent sinus infections. Many individuals with Sjögren's syndrome notice a pattern: frequent sinus infections that seem to return no matter the treatment. This isn't just coincidental. The autoimmune nature of Sjögren's affects the mucous membranes, including those lining the sinuses, leading to dryness and reduced mucus production. This dryness hampers the sinus's natural ability to clear pathogens, making infections more likely. A 2022 study published in BMC Infectious Diseases analyzed data from over 14,000 patients undergoing surgery for chronic rhinosinusitis, or CRS. The researchers found that individuals with Sjögren's syndrome were 2.5 times more likely to develop CRS compared to those without the condition. Notably, the bacterial profile in these patients differed, with a higher prevalence of Pseudomonas aeruginosa, a pathogen known for its resistance to standard antibiotics. This suggests that the altered immune environment in Sjögren's patients not only increases infection risk, but also influences the type of pathogens involved. For those living with Sjögren's, this means that recurrent sinus infections may be more than just a nuisance. They could be a manifestation of the underlying autoimmune process. Recognizing this connection is crucial. If you're experiencing persistent sinus issues, it's essential to discuss them with your healthcare provider. They might consider tailored treatments, such as specific antibiotics or therapies aimed at improving mucosal hydration, to address both the symptoms and their root cause. Understanding the link between Sjögren's syndrome and sinus infections empowers patients to seek appropriate care and potentially reduce the frequency of these infections. Next, number 5. Skin sensitivity to UV light and heat. Ever noticed your skin reacting oddly after a sunny day? For some with Sjögren's syndrome, this isn't just a coincidence. Sunlight, particularly its ultraviolet rays, can provoke unexpected skin responses. In a study published in the Journal of Investigative Dermatology, 2002, researchers exposed 14 Sjögren's patients to controlled UV light. Remarkably, 11 of them developed skin reactions like prolonged redness and papules. These reactions weren't just superficial. Skin biopsies revealed immune cell infiltration around blood vessels, indicating an inflammatory response. So what's happening beneath the surface? UV exposure can trigger an overactive immune response in Sjögren's patients. Instead of the usual protective mechanisms, their skin may become inflamed, leading to rashes or other lesions. This sensitivity isn't limited to natural sunlight. Artificial sources like fluorescent lights can also be culprits. If you've experienced unexplained skin reactions after sun exposure, it might be more than just a sunburn. Consulting with a healthcare professional can provide clarity and guidance on managing these symptoms. Next, number 6. Esophagitis. Navigating the challenges of Sjögren's syndrome often brings unexpected hurdles. One such hurdle is the discomfort and pain associated with swallowing, a symptom that can significantly impact daily life. Recent research has shed light on this issue. A study published in Scientific Reports in 2024 utilized a bidirectional Mendelian randomization approach to explore the relationship between Sjögren's syndrome and gastroesophageal reflux disease, or GERD. The findings revealed a significant association, indicating that individuals with GERD have a higher risk of developing Sjögren's syndrome. This suggests that the esophageal inflammation characteristic of GERD could be a contributing factor to the onset of Sjögren's syndrome. Understanding this connection is crucial. It emphasizes the importance of addressing esophageal health in the management of Sjögren's syndrome. If you're experiencing persistent swallowing difficulties or discomfort, it's essential to consult with a healthcare professional. Early intervention can help manage symptoms effectively and improve quality of life. Next, number 7. Dysautonomia. Many individuals with Sjögren's syndrome experience episodes of dizziness or lightheadedness, especially upon standing. This isn't merely a fleeting sensation, it's often a sign of autonomic nervous system involvement. The autonomic nervous system, or ANS, regulates involuntary bodily functions, and its dysfunction, termed dysautonomia, can manifest in various ways. In primary Sjögren's syndrome, the immune system's attack isn't limited to moisture-producing glands. It can extend to small nerve fibers, including those governing autonomic functions. This can lead to symptoms such as unstable blood pressure, irregular heart rates, and gastrointestinal disturbances. A study published in Frontiers in Immunology in 2021 highlighted that autonomic dysfunction is prevalent in primary Sjögren's syndrome, with patients exhibiting a range of ANS-related symptoms. Recognizing these manifestations is crucial. If you're experiencing such symptoms, it's essential to consult a healthcare professional familiar with Sjögren's syndrome. Proper evaluation can lead to targeted interventions, improving quality of life and managing the systemic effects of the disease. Next, number 8. Interstitial lung disease. Breathing shouldn't feel like a struggle. Yet for some living with Sjögren's syndrome, it does. Not because of the usual suspects like asthma or infections, but due to a lesser-known complication, interstitial lung disease, or ILD. In a recent study published in the Journal of Clinical Medicine, 2023, researchers found that ILD can be the first sign of Sjögren's in some patients, even before the classic symptoms appear. This means that a persistent cough or unexplained shortness of breath might not just be a minor issue, it could be an early warning sign. The lungs in these cases show signs of inflammation and scarring, making it harder to breathe and reducing oxygen levels in the blood. Over time, this can lead to serious complications if not addressed. Early detection is crucial. High-resolution CT scans can reveal changes in the lung tissue, and pulmonary function tests can assess how well the lungs are working. Treatment often involves medications to reduce inflammation and slow the progression of the disease. If you're experiencing persistent respiratory symptoms, it's essential to consult with a healthcare professional. They can guide you through the necessary tests and, if needed, start appropriate treatment to manage the condition effectively. Next, number 9. Kidney problems. In primary Sjögren's syndrome, or PSS, the immune system doesn't just target moisture-producing glands, it can also affect the kidneys. This often manifests as tubulointerstitial nephritis, TIN, where immune cells infiltrate the spaces between kidney tubules, leading to inflammation and impaired function. A recent study published in Scientific Reports, 2025, analyzed 1,306 PSS patients and found that 2.8% had renal involvement. Of these, 17 had tubular involvement, 15 had glomerular involvement, and 3 were unclassified. Notably, 44% of patients with renal involvement showed impaired renal function at the last follow-up visit. The study also observed a higher prevalence of lymphoproliferative diseases in PSS patients with renal involvement compared to those without. These findings underscore the importance of regular monitoring for kidney function in PSS patients, even in the absence of symptoms. Early detection and management are crucial to prevent long-term complications. Next, number 10. Skin rashes. Skin changes in Sjögren's syndrome can be more than just a cosmetic concern. They often reflect deeper immune activity. Many individuals notice patches of redness, purplish spots, or itchy areas that seem to appear without warning. These aren't merely surface issues, they're signs of the immune system's involvement with the skin. A study published in Journal of Cutaneous Medicine and Surgery highlighted that up to 67% of patients with Sjögren's experience xerosis, or dry skin. This dryness isn't just uncomfortable, it can lead to cracking, itching, and even infections. The study also noted that these skin manifestations are often linked to the underlying autoimmune activity of the disease. Moreover, the study emphasized the importance of recognizing these skin symptoms early. Timely identification can lead to better management strategies, potentially preventing more severe complications. For instance, addressing skin dryness promptly can reduce the risk of infections and improve overall quality of life. If you're noticing unexplained skin changes, it's essential to consult with a healthcare professional. They can determine whether these symptoms are related to Sjögren's and advise on appropriate treatments. Early intervention can make a significant difference in managing the disease's impact on the skin. Next, number 11. Brain fog. Many individuals with Sjögren's syndrome find themselves grappling with a persistent mental haze, struggling to recall words, maintain focus, or process information efficiently. This cognitive dysfunction, often termed brain fog, is a prevalent concern among patients. Recent research underscores the significance of this symptom. A 2023 study published in Arthritis and Rheumatology revealed that 75% of Sjögren's patients described experiencing brain fog. The cognitive challenges reported included memory lapses, 96%, difficulties concentrating, 70%, trouble verbalizing thoughts, 65%, and impaired executive function, 59%. These cognitive issues aren't merely side effects of fatigue. They often occur independently. Advanced imaging studies have identified functional changes in specific brain regions of Sjögren's patients. Alterations in areas like the frontal gyrus and precuneus, which are crucial for memory and attention, have been observed, correlating with the cognitive symptoms reported. The underlying mechanisms are still being explored, but evidence points to factors such as immune-mediated inflammation, autoantibody activity, and potential disruptions in neurotransmitter pathways. These elements may collectively contribute to the cognitive disturbances experienced by patients. Recognizing and addressing brain fog is essential. If you're navigating these challenges, it's important to consult with healthcare professionals who can provide guidance and support tailored to your needs. Next, number 12, vaginal dryness. Many women with Sjögren's syndrome notice changes in their intimate health that are often overlooked. One such change is a persistent lack of vaginal moisture, which can lead to discomfort, irritation, and challenges during sexual activity. Recent research has provided insights into the underlying causes of this symptom. A 2024 study published in the Journal of Rheumatology examined vaginal tissue from women with primary Sjögren's syndrome. The researchers discovered a significant increase in interferon signaling pathways within the vaginal tissue. This heightened immune response was associated with inflammation in the vaginal wall, potentially contributing to the sensation of dryness and discomfort experienced by patients. These findings highlight the importance of recognizing vaginal dryness as a symptom of Sjögren's syndrome. If you're experiencing such symptoms, it's essential to consult with a healthcare professional. They can provide guidance and support to manage this aspect of the condition effectively. Next, number 13. Headaches. Many individuals with Sjögren's disease experience persistent, intense headaches. These aren't just occasional discomforts, they can be severe and debilitating. Recent research indicates that nearly half of those with Sjögren's report migraines, often without aura, and tension-type headaches are also prevalent. These headaches tend to be more intense and frequent than those in the general population. The underlying cause is linked to the autoimmune nature of Sjögren's. The immune system's attack on the body's own tissues can lead to inflammation affecting the nervous system, contributing to headache symptoms. In some cases, these headaches may even precede other classic symptoms of Sjögren's, such as dryness of the eyes and mouth. It's essential to recognize that these headaches are a significant aspect of Sjögren's and not merely coincidental. If you're experiencing persistent headaches alongside other symptoms, it's crucial to consult a healthcare professional for a comprehensive evaluation. Next, number 14. Increased risk of lymphoma. In Sjögren's syndrome, the immune system's misdirected attack on moisture-producing glands leads to chronic inflammation. Over time, this persistent immune activity can cause B lymphocytes to become overactive, increasing the risk of mutations that may result in non-Hodgkin's lymphoma, or NHL. Recent studies have highlighted that individuals with primary Sjögren syndrome have a significantly higher risk, estimated between 10.5 to 48 times greater, of developing NHL compared to the general population. This elevated risk is particularly associated with the mucosa-associated lymphoid tissue subtype of non-Hodgkin lymphoma, which often affects the salivary glands. Certain clinical features can further increase this risk. For instance, persistent swelling of salivary glands, lymphadenopathy, enlarged lymph nodes, and the presence of specific autoantibodies have been identified as significant predictors for lymphoma development in Sjögren's patients. It's important to note that while the risk is elevated, not all individuals with Sjögren syndrome will develop lymphoma. Regular monitoring and early detection strategies are crucial for managing this risk effectively. If you have concerns about lymphoma risk associated with Sjögren syndrome, it's advisable to consult with a healthcare professional for personalized assessment and guidance. Next, number 15. Neurological issues. Sjögren syndrome doesn't just cause dryness, it can also affect your nervous system. Some people experience numbness, tingling, or even burning sensations in their hands and feet. This happens because the immune system, which is supposed to protect you, mistakenly attacks your nerves. A recent study published in Frontiers in Neurology, 2023, found that about 20% of individuals with Sjögren syndrome develop peripheral neuropathy. This condition leads to symptoms like numbness, tingling, and pain, especially in the hands and feet. Additionally, some patients experience issues with their central nervous system, leading to problems with memory and concentration. These neurological symptoms can significantly impact daily life. If you're feeling unusual sensations or cognitive difficulties, it's essential to consult a healthcare professional. Early diagnosis and treatment can help manage these symptoms and improve quality of life. And that's it for today's video. We hope you now have a clearer understanding of Sjögren syndrome and its symptoms. If you or someone you know is experiencing any of these signs, don't ignore them. It's always better to get checked early. Now we want to hear from you. Do you or anyone you know manage this condition? How do you cope with the symptoms? Share your experiences in the comments below. It could really help others going through the same. If you found this video helpful, type "helpful" in the comment box. That really motivates us to bring you more content like this. Don't forget to like, share, and subscribe if you want more powerful health insights. Thank you for watching, and we'll see you in the next one. Stay healthy, stay informed,